You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, a new treatment option for people suffering from gum disease or periodontal disease. According to my first guest, you don't have to have bleeding gums, bad breath, or loose teeth. With this new, we're talking about laser dentistry today. With us, we have an expert on this topic. He is a board certified periodontist. We've had him on the program before talking about dental implants. Today, we're talking about how to avoid losing your teeth. With us, we have Dr. Mark Sams. Dr. Sams, welcome to the program.
Thank you for inviting me out again.
Now, first off, for a working definition, like what is gum disease or periodontal disease and what are the symptoms? So people watching this know, maybe that's me, right?
So, periodontal disease is a bacterial infection. It's like any kind of infection that causes destruction, loss of bone, soft tissue. You have bleeding gum. That's why you have the bleeding gums. That's why you have the loose teeth. It's because you're losing bone around those teeth. You have the teeth start to shift. You have space between it. You start getting food packed in between your teeth.
So your teeth start to get spaces.
Yes.
How is that gum disease possibly?
How is that gum disease? Because of the destruction of the bone. It allows for those teeth to shift around and get loose. Also, you got people that grind their teeth. That also causes those teeth to move around and shift.
Okay.
And because they're losing bone structure because of the infection. You have puffy red gums. That's something that we could take care of. You smile, you can see it. I mean, it's pretty obvious. It's not pink and healthy.
Okay. Now, this is the number one way you lose your teeth.
Yes.
Like if there's 30 million people that wearing an upper lower denture, according to Google search.
Right.
Most of them started with gum disease?
Most start with gum disease. The second one would be decay, but gum disease is the number one.
Okay.
For sure. They say that over 50% of the people have moderate to severe periodontal disease. 30% has moderate to severe periodontal disease.
Okay. Now, there's two ways to take care of this bacterial infection, and that's why we invited you on the show. One is to, and I'm saying it this way, but to cut it out, to cut out the bacterial infection, and the other one is to kill the bacterial infection with your laser.
Correct.
So tell me about the traditional way every periodontist takes care of this gum disease.
So the traditional way, this is how a patient normally gets referred to us. The patient's been through deep cleaning at their general dentist's office and it continues to get worse. The bleeding continues, the swelling, the discomfort continues. Patients aren't normally happy about the time they get to our office. And sometimes they're too far gone, which we discussed that in the previous one about dental implants and all that other stuff. But basically it's the traditional way of handling the disease. They already did the deep cleaning. So what's that leave us? Basically we're trying to cut out the bacterial infection. That includes healthy and diseased tissue that we're doing. And a lot of times we're reshaping the bone or cutting the bone away to make the tissue lay down.
So do you have to peel back the gums, actually cut the gums and peel it back to get access to the teeth?
Correct.
Is that right? That's in the old way.
Right, exactly.
It's still being done today.
Correct. And that's because you can't see the buildup on the teeth. You got to cut it back and look at it.
Okay.
So yeah, you're peeling back the tissues. It's not the most appealing way to talk to a patient about, yeah, we're going to be peeling back the tissues and cleaning it all up and cutting some bone away and all things like that. So normally how it's normally done is the gums get peeled back, we clean it up, we suture it up. Normally we're not doing the whole mouth.
So there's stitches involved.
Oh yeah,
in
there's
this.
sutures involved
So you
in there.
stitch the gums back up.
You have to stitch them up to cover up the bone because that helps with the discomfort, but people still have sensitivity, discomfort. That's why we only do like a small portion of the mouth normally, because they got to eat.
At a
too
time,
much
like
pain.
just small sides, like one side of their mouth one day, have them come back a month later, do another
Correct,
side.
exactly. So it takes a lot longer, and it's taxing for the patient and for us to do it also, do it correctly anyway. Basically the way we do it, which is alternative treatment, the new treatment way of doing it is using a laser.
Okay.
So we're killing that bacteria. The other way, you're removing the bacteria, but we're actually killing that bacterial infection that occurs in the mouth. And basically, the misconception about it, I guess, would be that it's not really surgery. We're actually having to numb the patient up, and we're going around the teeth. And like I said, that laser energy is killing that bacteria because it's attracted to that bacteria, selectively attracted to the bacteria in the mouth.
So the laser picks up the pigment of these?
The pigment of the bacteria, black pigment.
All right.
Which causes the destruction and causes the bone loss, the loose teeth, the bleeding gums, and things like that. So That's the advantage. It's minimally invasive. It's attacking the right bacteria, not taking everything out. So basically, that tissue gets really healthy because you've gotten rid of that bacterial infection, and it hugs the tooth, actually, and it tightens up around the tooth.
So when you have gum disease, because you've helped me understand this, so the gums move away from the teeth.
Correct.
That's why they get loose.
Correct.
So when you kill this infection, what? The gums hug the teeth again.
Exactly.
Is that right?
We're regenerating the tissue or the connection between the tooth and the tissues, and it tightens up around the teeth. So the teeth actually get tighter, or they're not as loose with this procedure.
With this laser, so you go around the mouth, how soon do the teeth start getting stronger?
Almost immediately.
Is that right? And what about the bad breath? And what's causing the bad breath when you have gum disease?
The bacteria is what's causing the bad breath. I mean, bacteria produces sulfur and all that stuff, and that's the bad smell you get from the infection. And once you clean that up or you kill that bacteria, then the bad breath goes away.
Okay. Now, flossing.
Yes.
You say that if you're bleeding when you're flossing, that's bad. But isn't that okay? A little bit? I mean, a little bit of blood. No.
When is a little bit of blood okay? If you have a little bit of blood coming through your nose,
but isn't that normal to have a little bit of blood?
It's not normal.
No, really?
It's not normal. Unless you're just like causing trauma to your tissues.
So it means you have an
flossing.
infection?
Right, exactly. You have an infection whenever you're bleeding. You have these patients and they're like, I'm bleeding a little bit. I hear it all the time, and it's like, you're not bleeding a little bit. That's an infection in your mouth. You wouldn't let that go. That wouldn't be okay anywhere else in your body to have an infection. So if we get those people when they're doing that or they notice those symptoms, we can save teeth. They don't have to get implants. It's a lot cheaper to do it at that point. When we get patients too late a lot of the times, and that's so unfortunate.
So you believe, so if you have the symptoms of gum disease, or if you've been told you have gum disease,
Right.
seek a periodontist that also has a laser.
Correct.
You believe that?
Yes, definitely. I mean, that's the best treatment. I would do it. I would tell my family to do it. Why would you go through the process of cutting away the teeth and the gums and all that if you have another option? I'm not saying that, hey, I never do the traditional way, but this is my first choice if I could do it now, for sure. Like,
so it's rare that you have to do the old cutting procedure.
Correct.
Now you just delicately go around the laser, kill it, and the teeth are good and healthy again?
Exactly.
Really?
They maybe even stronger than when you do the traditional way, because the traditional way, the way to get more bone support around it, you have to pack bone after you clean it up, cut the tissues, you got to pack bone in there and suture it all up. This way your own body's healing itself, because it's basically killing that bacteria. You know, the blood that you have that's healing it and regenerating and causing a healthier environment.
So knowing what you know now, that means using the laser to get rid of the gum disease.
Right.
You can't do it any other way.
Correct.
I mean, if they took away your laser, what would happen?
Oh my gosh, it would change the way I did my practice. It would change the patients that I see. I have patients that come in, I have patients that are present that's had it the traditional way and get it the laser way. And those are my best patients, because they know what it feels like to get it the traditional way. And I had literally had several patients say, where was this 10, 15 years ago when I was getting the traditional way? So it would definitely impact my practice. It's impacted in a positive manner, but if you take it away, it would be pretty devastating.
So how is it you could avoid, an extraction of a tooth with this laser? That's the part I don't get.
So, especially if you catch it early, it allows for bone to regrow around that tooth and the tissue to tighten up around that tooth. Like I said, it hugs the tooth and it makes it more stable, so you don't have to worry about removing teeth.
So teeth that you used to pull maybe 10 years ago, you're not pulling today?
Correct.
Really?
And I even say teeth that I would have not treated or had to get pulled with the traditional way, I'm able to treat with a laser. It just allows me to get farther access to areas that I wouldn't have been able to do it with the traditional way. And that's the benefit. We're able to save way more teeth with the laser than I ever was with any other treatment option.
Okay, good. So if somebody just tuning in, we're talking about gum disease today and laser dentistry. So if you have bleeding gums, bad breath, loose teeth, big puffy gums, your teeth are starting to break, you may want to look into laser dentistry. And Dr. Sam says it's a bacterial infection. And there's two ways to get rid of it. Cut it out. I don't want to put words in your mouth, but that's one of the ways, is to kind of cut it out, or to just kill the bad bugs. Now, we have a slide that you showed me of, like, you swab the mouth, I guess, put it on a slide, and it's showing all that. So what are we looking at right here?
So Basically, in our office, we have a microscope that we're able to take a bacterial sample of the patient and look underneath and see what kind of bugs they have. So we could tell them, hey, you got activity. They
So
can
this
see
is
it.
like bad bugs? I mean, this is the
Right,
bad stuff
right.
in your mouth.
Yes, and it's teeming with bacteria most of the time because we're treating.
Can you spot and know what those things are?
Oh, hands down. It's certain bacteria in the mouth that are
What
related
are some of the bugs I'm looking at?
You got spirochetes. Those are little spiral-looking bacteria, and they're like teeming and they're moving and they're really active. And then you got the healthy ones that are just like little dots and they might barely be moving. So yeah, we're able to identify which ones that are causing the damage in your mouth.
Okay, now the second slide. Things have slowed down. What's that?
That's basically a healthy mouth. And you have a healthy mouth, you have less activity or movement in your mouth. When you have unhealthy,
Can you show people before and afters? Like you show them the bad bugs, then you show them the after with the bugs dead.
Yes. So basically when a patient comes in, the first appointment, we take a sample of them, we look at it in a microscope, we show them, and then after we finish treatment, we take another sample and we're able to show them that one too. So we're able to compare to see, hey, does this treatment really work for you? And so that's how we do it, and that's basically confirmation that we've actually done something for that patient. Besides, patients normally say within that week or so when they come back, oh man, my gums are not bleeding. Or I feel my teeth tighten up and it doesn't feel the same. I just had a patient this week that came in and he's like, you remember when we did this about 3 or 4 years ago and my teeth were bleeding and I had swelling, I had all this pain and discomfort. He's like, it's nothing like that now. I can brush my teeth, I can eat what I want to, and that's the best thing you can have. You know, we talk about implants. The best implant is your natural teeth. There's no better implant than that.
So the laser allows you to save the teeth.
Right, exactly. I'd rather save the teeth than take the teeth out.
Now you call it and we have a video of how this works, but you call it this LANAP protocol. What does that mean?
Correct. This laser-assisted new attachment procedure, long word. LANAP is all you need to remember. Basically, it's a procedure where we use the laser, we go around and open up the site, then we go a little bit deeper to where the bugs are to help kill those bugs, and then we use instruments to clean up the teeth or the roots of the teeth where the bacteria is at.
Okay.
After that, we'll go around the teeth again with the laser, and that creates a kind of a blood clot around that seals off the tooth or the root of the tooth from the bacteria, but it also helps regenerate. Your blood has a lot of growth factors in it that help regenerate hard and soft tissue around the tooth, and that's the trick as far as getting it stabilized.
So when I see this video and it looks like things are being vaporized,
right?
Is that kind of like what's going on?
Correct. That laser energy is attracted to that bad bacteria that we were talking about, those spirochetes, those black pigmented bacteria, and so is able to selectively kill that without killing the good bacteria in the mouth. I have another patient. This guy was so amped up when he came back after the treatment because basically he came in and he's like, hey doc, I don't feel right. I feel like I got the flu and things like that. And it's like, yeah, you got some issues with your teeth. You got some pocketing and bleeding.
What does pocketing mean?
Pocketing is basically loss of bone. The soft tissue stays up, the bone level's down, and it's able to harbor that bacteria. And that's why you get tricked sometimes, or people get tricked because they're cleaning their teeth, they're flossing, but they're not getting all the way down deep.
So these bad bugs hide underneath the gum line.
Right, exactly. Where you can't reach them. And that's why you got to go to the dentist.
All right.
And so this guy comes in, and after the treatment, he always gives me a hug. He is so excited. I mean, it's amazing. He basically like, I got energy again. He did martial arts, and he's like, man, this is the most amazing thing. He's like, I'm going to tell everybody, because his energy came back. And I've had several patients like that.
How could that be?
It's kind of just like when you have the flu.
Okay.
You're all drained, your whole body's drained.
Because you're fighting this infection.
Fighting this bacterial infection. And same thing with your mouth. You're fighting this bacterial infection, so your body's focused on that. So, yeah, you get your energy back once you kill that, eradicate that bacteria.
So when you hear, like, somebody's just, like a hygienist that says, you just need to brush and floss more, what do you think when you hear that?
For some patients, you could brush and floss all day long, but it's not going to kill those bugs. They got a genetic component. They're susceptible to the bacteria, and they have to have treatment. We have to get down there and kill the bugs for them.
Now, what about this health crowd? The the people that are trying to take care of themselves, they don't like antibiotics. Can you do this without antibiotics?
Yeah, for
in
sure.
many cases?
Yeah, you could do it without antibiotics.
Because that's the current treatment, right?
Right, exactly.
Antibiotics
Correct.
and surgery.
Correct. You can do it without antibiotics. Basically, with the laser, you're basically attacking that. You're killing the bacteria just like the antibiotic would. You know?
Okay.
So, yeah, that's definitely an option for those patients that are against the antibiotics.
How does it compare to, like, statistically? Are there any published reports? Like, what's better, the older cutting way where you peel back the gums and
yes,
clean it, or the laser?
Definitely, it's definitely several researches that have been done, and they say either it's equal to better. Certain statistics as far as pain and the period of time that it takes. I mean, the laser is superior for sure.
Because if it's equal results, right? Because I had a periodontist.
Right.
I said, I'm knowing you're coming in here, periodontist from St. Louis, and he says, Randy, the results are similar.
Right.
I go, well, if they're similar, the laser is better because it's low downtime and it doesn't hurt.
Exactly.
Right? I mean,
It says it's significantly less discomfort, pain, less downtime. You could get it done more. You can do the whole mouth. We do the whole mouth a lot of the times if it's necessary. You don't have to do one little spot at a time and picking spots. Okay. And patients, like I said, the best thing I have is when the patients had traditional surgery versus when they had the laser surgery. Laser surgery wins every time.
So the laser keeps you from losing your teeth?
Correct.
Period.
Correct.
Now, do you think the future of dentistry, maybe 100 years from now, you'll still have the hygienist that cleans your teeth, but do you think there'll be a lower level laser that they'll go around the mouth, clean it up? Think that'll ever happen?
I think they're already using that.
Okay.
I mean, that's basically maintenance for patients that hadn't got to that point where it's so severe. And that's why it's important to get to someone that has the laser that's a periodontist.
Now, this group of people that have gum disease, they know who they are, probably? Do they call it gum disease or do they call it periodontal disease?
They call it gum disease for sure.
So the people with gum disease, they have to go in every 3 months and get this deep, deep cleaning.
Right.
But if you get the laser, does it eliminate having to go in every 3 months?
Correct. If it's caught early enough, yes, you could skip that component where you're going in and getting deep cleanings and doing all this all the time. I mean, that's the key, is catching it early enough. And that's why I said, make the phone call if you're a general dentist or the dentist that you're seeing and you're concerned about it, and we could take a look at it.
So like boats, right?
Right.
Boats have
little
barnacles,
right?
Is that kind of what's going on under the gum line?
Yes.
So they're having to go in and scrape those off?
Exactly.
But the laser kills them and keeps it from coming back?
Correct.
A little bit?
Right, exactly.
Or a lot?
I would say a lot, because you're able to get that healthy tissue, you're getting bone back, so it's not able to get down as deep as it was before. Okay. So you're sealing it off. I mean, that's the whole point of the advantage of it against traditional surgery. If you're doing traditional surgery, you got to add the bone to it to be able to do that. And once you get the bone support, the pocket reduces, so it can't get down.
When you say the pocket, that means because the gums are moving away from the tooth.
Right, the pocket, the teeth the tissue's moving away. And so once you get the environment healthy, the teeth tighten up and you're snugging it up against the tooth. And so now you have a better environment, and it's a win for everybody.
So back to the bad breath for a second. So if the bad breath, let's say they have a little bit of gum disease, causing bad breath. Their teeth look pretty good, but they have bad breath. They can't get rid of.
Right.
With the laser, how soon does the bad breath get away? And is that common?
It's very common.
In for that?
I think about 2 weeks ago, I had this lady, and she was adamant about, I got bad breath, I got bad breath. The lady comes in, and we use the laser on her. We go around the teeth, and we're killing the bacteria. We seal it off, and she comes in for a follow-up appointment. And, a lot of times, we do this every day. So a lot of times, I don't even think about what results they got or what they're going to realize. So she comes in, and I'm like, hey, how you doing? Everything feel okay? You got a little sensitivity or anything like that? And she's like, man, my bad breath. That was the first thing she said. My bad breath is gone. I don't have that taste. Thank you so much. And it's a basically instant result. And it makes sense because it's eradicating the bacteria.
And this is all over the place. I mean, there are tens of thousands of people, would you say, in Wichita?
Oh, for sure.
That you could help with this laser.
Correct.
But they don't even know it's out there.
Right, exactly.
Really?
Yep, yeah.
Let's say a 100-mile radius. Would you say hundreds and hundreds of this old technology, old technique of getting rid of gum disease is keeping periodontists busy?
I'm the only periodontist within a 100-mile radius that has this laser, so yes.
Okay, as of today's taping.
Today's taping, yes.
So people don't know. And how do people hear about you that you even have it? They just Google it?
Well,
Are they Googling laser dentistry, or what are they doing?
You can Google laser dentistry, you Google LANAP. We've done seminars, we've brought in speakers, I've done lectures on it, and we try to expose people as much as possible. And that's one reason for doing this interview, is to get people educated, because people don't know. They just don't know.
So if you don't want to lose your teeth, and you've been told you have gum disease, you better do something about it.
Correct.
Get a laser.
The sooner the better. The sooner the better.
Is that right? And what are the age ranges of people that are doing this? Or that you've done it on, I should say.
I've done it on 20 to 90s.
A 90-year-old? Why would a 90-year-old want to do this?
They want to save their teeth too. They have teeth and they want to save them too. So at the end of the day, it's giving people what they want. And that's the ability to smile and chew. And
so if you have these symptoms, like the bleeding gums, the bad breath, the puffy red gums, especially early stages,
right,
you got to get in there and do this.
You got to get in there.
It's a lot less expensive.
Yes.
When you get them at the flossing stage where they're starting to bleed.
Oh my gosh, it is. Yes, it's a lot less expensive. It's a lot less time. And that's over a long period of time. Initially, it's a lot less time, but visits that you have to do afterwards is a lot less also.
Okay, so people watching this know, okay, they're currently scheduled for, what do they call it? Periosurgery? Like, what's the lingo that the patients call it? Like, I'm going next week to get...
At our office?
No, or
just in general. Like, yes, periosurgery, or
so they know they're
pocket reduction, or gum surgery.
So they should look for a doctor then that has the laser.
Correct. Well, I mean, it's an option. And you got to go to someone that has all the tools. You don't want to be limited because they're limited. I mean, you want to have the options to treat your condition, because everything's not the same.
Do they teach this in perio school yet?
Yeah,
they're teaching lasers?
Yes, they're teaching lasers in school at this point.
So if your periodontist is over 30, over 40, or over 40,
correct,
they weren't trained laser dentistry.
Correct,
so
exactly.
you have to find like a progressive periodontist.
Right. It's the new treatment. It's the new treatment alternative to traditional surgery.
Now, when you have friends that are periodontists, or you don't associate with other periodontists? You have friends with periodontists, right? I'm dying to know what you guys actually talk about when nobody's around. I'm sure it's not the most exciting thing, but when two periodontists get together, and your buddies that don't use the laser, what do you tell them?
I actually have a friend that was a close friend, and I was like, man, you got to get this laser. And I was like, it's going to help you. It's going to help your patients. You could treat so much more. He got the laser. He loves it.
But they're expensive. They're like $100,000 or something, right?
They're expensive, but it's worth it. I mean, at the end of the day,
yours is well paid for by now.
At this point, I've been using it for a while, so yes.
Now, we should mention again, Medicare, Medicaid doesn't cover this.
Right.
Even the best dental insurance doesn't cover the whole thing, but you say people are financing this.
Correct. The people are financing. We have several options for financing. Yes, you have to have good credit, and we look at that, but we have treatment plans and things like that at the end of the day to give you that option, or at least you make it easier.
So have you lasered your friends or family?
Well, my family lives in another state, but I would. But I've had friends, I've had team members get it done, and basically they say what everybody's saying, like, oh, that wasn't that bad, or hey, that was amazing. I'm glad I didn't have to go the traditional way of doing it. And so I think it's a fear. That's the thing about the laser. It eliminates that fear that people think about when they're thinking about the traditional way. And that's why it's kind of grown my practice, is because now they know it's a minimally invasive way to do the procedure at the end of the day, and they have that alternative, because patients are scared. They don't want to go through cutting back the gums and cleaning all that out, and if they feel like it's a better way, or it is a better way of doing it, that's the win. And
now, I've had periodontists tell me privately, they say, Randy, it hurts so much, the old surgery, that you only do one side of the mouth.
Right.
And then you have to beg the patient to come back in to do the other side of the mouth, and good luck trying to get them back in.
Right.
Whereas with the laser, he said you could call them the next night and they're fine.
Correct. On several occasions, I've called them, and like I said, a lot of times we'll do the whole mouth. And so that kind of eliminates them running away, I guess you would say, but they don't have any pain, or they're like, oh, there's very little discomfort, right? And it's nothing like the traditional way. of doing it.
So no more bleeding gums, bad breath, loose teeth, even tooth loss. That means if
Right,
you catch them
exactly.
early, you could avoid the losing
Exactly. I mean, it's been some teeth that I was like, and the patient's like, I really want to save my teeth. And I was like, well, we'll use the laser. And I'm not exaggerating. It is phenomenal, some of these results. I mean, the tooth saving teeth. I mean, the tooth is moving around. We got to take it out.
Like a wobbly
and I
tooth.
said that. Like, I said the tooth has to come out. And the patient's like, no. And they come back at the end of the result. And I'm like, holy cow, I can't believe it. And
the laser saved the tooth.
the laser saved the tooth. There's no way that would have happened with traditional surgery. It's just,
So the tooth, let's say this is the bone, right?
Right.
So the bone starts going away and the tooth gets loose.
right.
And then the gum's moving away from the tooth because of
Correct.
this infection. Laser kills it, bone comes back a little bit, gums grab the tooth.
Right.
Is that kind of how it works?
That's exactly how it works.
So you're saving teeth that you would have pulled a long time ago, right?
Correct. It's amazing. It's been so many cases that I'm like, it won't work, or hey,
You're
we're gonna do.
surprised sometimes.
Oh yeah, for sure. It's like we're doing the whole mouth, and we got some teeth that I would normally take out, but we're just gonna go around them with the laser just to kind of see what happens. And we could take out the teeth at any point. You're killing the bacteria around it, and they still got their teeth in there. It's just amazing.
Are the general dentists that refer you these patients, are they ever surprised, like saying, I can't believe it?
They're referring more. I know that.
Is that right?
Yes, I mean the general dentists like that option because their patients are telling them, I don't want to go to the periodontist so he cut. Well, he has this laser that's going to grow the bone back, and we give them information and booklets so they're able to show the patient, hey, I mean, you can see it on the radiograph, the bone is back. And we haven't done any bone grafting.
You stimulate it a little bit.
Right, exactly.
So I know in plastic surgery, dermatology, they're on my show.
Right.
Plastic surgeons, 20 years ago when I first started the show, they would poo-poo lasers.
Right.
Now, they couldn't do it
Everybody's
any other way.
using lasers.
Because it
especially in medicine.
stimulates the collagen.
Correct.
Same kind of thing with the gums, makes them healthy and plump again.
Exactly. I mean, like you said, medicine, everybody's using a laser at this point. Why not dentistry?
So this is the way to go. I want to thank you for coming to the show. We're out of time.
Thank you.
So if somebody has final message, bleeding gums, bad breath, loose teeth, they've been told they have gum disease, they've been told they have to lose teeth, you say look into the laser. What's your final message to them?
Just come and learn about your options at the end of the day. And
They get to meet you?
exactly. They'll get to see me for sure.
You'll have a laser in your hand?
Maybe.
All right, well, thank you for coming on the show. Good stuff.
Thank you.
Thanks. You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.